Hello, my name is Dr. Alex Poon, and today I'm going to be discussing some of the risks and complications and the safety associated with having a tummy tuck. So one of the first things that you want to be aware of when you are having any surgery are all of the potential risks and complications, and abdominoplasty is no different to that. Now, the first thing to say about it is that you really should be an ideal candidate for it in the first place, because it really is elective surgery. So for people that have large tummies, really want you to be at an ideal weight and to be very healthy before you would even consider having tummy tuck surgery. So get to your ideal weight so that, and for around about 6 months even, just so that you have a stable weight and your risks associated with the procedure start to drop off if that's the case. So with all risks, with any operation, there are general risks associated with any procedure. And there are ones specific to tummy tucks themselves. So if we talk about general risks, there's a 1 in 100,000 risk of a catastrophic anesthetic complication from the operation, so even death. So this is exceptionally rare, but we try to make sure that we have performing the surgery on patients who are ideally fit for it. So healthy patients in a proper hospital facility, as well as having a highly qualified anaesthetist with every procedure that we undertake, minimises the risk of anything happening like that. And even if you were to develop something like a unexpected allergy, you're in the perfect situation to have that problem because you've got a fully qualified anaesthetic team looking after you. So, as we start to talk about some of the specific complications, the one at the top of that list would be getting a clot in your leg that might even go up to your lung. So in medical terminology, that's called a deep venous thrombosis. And if it goes to your lungs, it's called a pulmonary embolus. Now, you typically get that problem when there is stasis of the blood in your legs. So if the blood's not moving around that much, such as you lying around all day, then you can get clots in the legs. And that can happen for people when they're catching long plane rides or train rides or even bus rides as well. It's a very reasonably common thing, but when it does happen, it can even be fatal. Now, we make sure we minimize that risk by doing everything we can to prevent you from having it. So there'll be special mechanical stockings that you'll be wearing. We'll have physiotherapists moving you around all the time. Nurses and doctors reminding you to move your legs, take deep breathing exercises as well. So that, in addition to special injections to minimize your risk of your blood clotting, means that the risk of having any of these problems tends to go down remarkably, but it can always happen. I personally have never seen a patient that has had a deep venous thrombosis after having a tummy tuck. So the reason is, I suspect, because we do everything to prevent it. Now, two other risks that we should talk about would include having an infection. We make sure we cover you with antibiotics all the time, both intravenously and with oral antibiotics eventually. You can also have problems associated with having a hematoma or bleeding. Now, when we talk about bleeding, we're not really talking about you bleeding to death. We're saying that, there may be a collection of old blood that may get stuck on the inside, and sometimes we might need to do another operation just to suck out some of that old blood because it will accelerate your healing process. It's an exceptionally rare event, but it's something that we keep an eye on to make sure you don't develop it. Now, you can always have a problem associated with scars or wound healing as well. That's common for every operation. Worst, perhaps, for people that are smokers. So if you are a smoker, we would strongly advise you to stop all smoking for around about 1 month before having this kind of surgery. There is a large list of all the things that might potentially happen. This is by no means an exhaustive list, but at least as a starting point for you to discuss or think about some of the bigger risks and complications that may occur. But with any discussion of complications, the next question really is that even though anyone can get a complication, if that happens, touch wood, it never does, You want to be looked after by somebody with the qualifications and skill, as well as the trust that you know it's going to look after you. And here at Park Clinic Plastic Surgery, you've got fully qualified plastic and cosmetic surgeons who are qualified with the Royal Australian College of Surgeons and the Australian Society of Plastic Surgeons. We have multiple appointments in Sydney hospitals all around Sydney, such as Royal Prince Alfred Hospital, as well as East Sydney Private, Westmead Hospital and Prince of Wales Hospital, just to name a few hospitals between Dr. Muradi and myself. So you know you are going to get the very best care in the very safest environment. Anyway, I hope this has helped. There is a longer list, as I said before, and I would be only too happy to describe all these things to you when we meet you face to face. Talk later. Bye-bye.